Hello, uh, my name is Ravi Vij. I'm a Chief Medical Officer here at My Cancer Haven, and today I have with me Dr. Ajay Nooka, who is one of the leading authorities on multiple myeloma. He has been on the educational and scientific committees of the American Society of Clinical Oncology and heads the myeloma program at Emory University, which is one of the premier programs in the country. Welcome, Ajay.
Thanks, Ravi. Thank you for having me.
It's a pleasure. So we're going to today talk about a little bit about the initial treatment and monitoring of patients with multiple myeloma, patients who are diagnosed recently, obviously want to know how to approach myeloma. So what is the state of the art in multiple myeloma? How do we approach the disease?
Absolutely, Ravi. I think if you look over the last decade, a decade and a half, we have gone a long way in how to treat multiple myeloma, not just about treatment, but how it has improved the lives of our patients. So first, when the patient gets diagnosed, we understood what is the best treatment to give. And those initial treatments that we give very early on have a huge impact in the later time or as later lines of therapy. So it is very crucial to identify what is the best regimen for these patients at the time of the diagnosis. People start to hear about transplant, non-transplant, all this jargon, but the way that I simply put it is the patient fit enough to tolerate a transplant with a chemotherapy regimen, or is the patient not fit enough? And that usually bifurcates the treatments of how aggressive we should be in the initial treatment phase. So once the patient gets diagnosed, once we determine whether the patient is ready for a transplant or what we call as a transplant eligible or non-transplant eligible, then you try to look for the risk features. So is the patient having any high